How many of you draw blood from a PIV, peripheral IV? No? Only new needle? Do you draw blood from an IV? Okay, do you draw blood from an IV first stick or after 1 day, 2 days? Perfect! So pediatrics, they don't care because they do it right. The adult side, however, we don't do it so well, okay? The reason why some hospitals have rules you cannot draw blood from an IV is because we keep hemolyzing the samples. We keep ruining the samples, and we're wasting so much money. The hospitals are saying, no, stop, please. We're losing so much money. Just don't do it. Just poke the patient another time. I'm hoping to give you guys a solution of how to reduce that hemolysis, especially for pediatrics and even adults. Hemolysis versus cavitation. Cavitation is the wrong word. It's barotrauma. That's what we're concerned about. All right, so what you want to do is pull with low pressure. This is the key. This is why we're hemolyzing the samples. Okay, how many of you draw blood and send it to lab? Nobody? Students, did you ever draw blood? Okay, good. Nurses, do you guys draw blood? Or do you leave it for the phlebotomist? Anybody? Okay, this seems to be the same problem across the whole country. So we've done a few workshops, and I'm finding out that the problem is the same across all of Latvia. All Latvian nurses have this issue. And in fact, Poland was here during the Congress, and so is Czech Republic. And I found out all of Europe, and even in the US, we all have the same issue for nurses. In fact, when I did some more research, I found out that the whole world, the nurses all across the world had an issue. In fact, when I did even more research, when I dug deeper, I found out that the whole solar system, all the nurses in Mars, in Saturn, and Pluto, they all had the same problem. In fact, I found out that the nurses all across the universe had the same issue. When we send it to lab, and we're like, yes, this is good. It came out easy. Now I send it. And then the lab calls and say, hey, it hemolyzed. It's your fault. We blame it on lab. We don't say, oh, I must have done something. No. Lab dropped it. Lab lost it. Lab screwed it up. It's not my fault. It looked good. It was good when I dropped it off. It's not. We're hemolyzing the samples before it even gets to lab. Let me show you why. Most of it's due to negative pressure. So this is the definition of barotrauma. So when we have a cell, a red blood cell, it's supposed to be nice and has a shape, right? So what happens when we pull too much?
When we pull with too much negative pressure and why our blood is hemolyzing. So I'm going to
watch the bubbles.
That with negative pressure.
How big did the bubbles get?
Look what happens to the bubbles. They expand and then collapse.
Do you see what's happening when I'm pulling on that syringe very hard? Okay, so if the bubbles are expanding, what's happening to our red blood cells? Is this red blood cell going to work? No. So when we draw from the IV, give me that blood! We're ripping the red blood cells. So don't pull very hard, pull gently. Sometimes you'll have to pull, pause, pull, pause, pull. What does the pause do? So we're closing that vein because we're sucking so much so quickly that we need to give the blood time to fill back up. And then we aspirate, and then we aspirate. Okay, so give it time to refill at the tip of the catheter or the tip of the needle. All right, so that's one of them. Also, have you noticed that there's bubbles coming out? Did you notice when you pull sometimes a little hard, you see bubbles? Yeah, that's barotrauma. That's hemolysis. So it's not leaking. How many times have I said, man, why are there bubbles